5 things you need to know about mole removal. 1. Criteria. What criteria do you need for mole removal? Most moles are cosmetic. They've been there for a long period of time without changing, and it bothers you to see them every day, or they get nicked at shaving, etc. However, some moles need to be removed for medical reasons. For example, if a mole is big, that is greater than 6 millimeters, which is a pencil eraser size, or if the mole is changing in size, shape, color, or texture, then it needs to be removed and sent to pathology for interpretation of whether it is a cancer and needs other treatment. 2. Anesthesia. Most of the time I do the mole removal in the office, and I have developed a cream with 4 numbing medicines that we put on it before, and this numbs it. And then I follow this with a technique that I learned in Oxford University in England, where I use a pressure technique, and most patients do not even know that I have numbed them when we've got them numb. 3. Method. What are the methods of removal of a mole? Largely there are 2. One is to shave the mole. Most dermatologists prefer to shave a mole, which is to take a knife and trim the mole at the skin level. Most plastic surgeons, including myself, prefer to excise the full depth of the mole. Now this is analogous to cutting a tree down. To shave it would be to cut it at the level of the ground and leave the tree trunk and the roots. Whereas the plastic surgeon would come in and take out the roots and the tree trunk in the ground and then pull the carpet of the grass over it. 4. Repair. What's the best way to surgically repair this excision? After having done this for 30 years, I have found the best way to repair the wound is to use layers of suture. So the deep layer is dissolvable, and the top layer is removable using a polypropylene suture. 5. Aftercare. How do you take care of this afterwards? Well, after the sutures are removed, I have found that to put on surgical glue, which stays on approximately 2 to 3 weeks, it's better than the old-fashioned surgical taping. And then this is followed by surgical creams that are recommended for scar treatment to improve the scar so that the scar is very difficult to see. These are 5 things you need to know about mole removal.